Monday, October 14th, and it is 7:55 a.m. Today is my first day of clinical rotations, first day of third year. Where has time gone? Thank you, Jesus. So today is orientation day. My first rotation is family medicine. So here's the fit for today. And I will be having some black flats, but right now can't really show you. Didn't really do much makeup. I put blush on and then I concealed around my eyebrows. I really need to get my eyebrows done, but haven't been able to do that yet. But today's the first day, so I have to head out of here. I have to figure out if I want to take the train or the bus today. I just want to look at the routes real quick on Google Maps to see which one will be quicker. But today it starts at 9:30. My goal was to leave here either between 7:50 to 8 o'clock, so I am on time today. I woke up at 6:30, but then you snooze. Woke up 6:45. So yeah, did pretty good. I already had a bagel. I'm about to take my iron pills. What else? I'm gonna drink some water. I'm gonna go to the bathroom again real quick, and I'm taking a Red Bull with me because no time for coffee. Okay, bye. So while I'm out here waiting for the train, it's 4:27 now. The bus is supposed to come at 4:32. So while I'm here, I am going to discuss what happened today. Earlier, I said, remember the time right now is 4 something. So remember how I said I was expecting, I don't know if you guys can hear me, a train yesterday. You know how I was saying that I was hoping to leave at 12 o'clock today. Now these people want to put us to work. So today I had to do go to the employee health because I hadn't done that yet. So I took there's a shuttle from the clinic to the hospital. So I took that. That was free. I went there to do the employee health. When I left there, it was like I took the shuttle. Our orientation ended around 10:30, because 10:30 was when I took the shuttle from the clinic to the hospital, right? And then my assignment is the clinic. So I went to the hospital because like around over there, that's where the employee health is. Then went to the employee health. I was there until like about 1, and then the next shuttle was 1:30 because our administrator told me that if I finished before a certain time, I should come back to the clinic. So I was hoping, like I said, me at the clinic would be a long time, so then I don't have to come back. But 1:30, so I was just like, okay, it's fine. So I went to the clinic, and then because I was like asking, I saw another student there, and I was like, he had mentioned that he had gotten there later than the rest of us that morning, right? And I said, oh, the people that were there earlier, like, are they still here? He's like, yeah. I'm like, because I thought they would have sent them home, because I was hoping that if I get there, then they'll be like, nah, like, you could go home. No. But anyway, I was with a resident, and he was super nice. I really liked him. I saw one case with him, but the patient was Spanish speaking. But funny enough, like, I understood everything that he was talking to about the patient. The patient was just coming for a certain thing. And then later on, he was discussing with me, like his other cases. And then for the day, like the other, there was like another 2 patients that he saw preview to the one that I saw with him. And he was mentioning something, because before I got paired up with him, he was already seeing one patient. So one of the doctors told me, okay, wait until he's done with this patient, and then you could go to see him go with him to see the other patient. So I was hearing him discuss with his preceptor, which is an attending, about like what the patient has, and then what he's expecting to do as part of plan, right? So funny enough, like when he was talking to me about it, I was like, wait, I thought this medication is for this. And he was like, and he looked it up, and sure enough, I was right. So he went back to the attending and said, oh, he wants to add on something. So that's a win for me today. It's break. Today is day 2. I'm wearing a sweater under this. This is not the sweater. This is a jacket. I don't even know how many degrees it is. All I know is cold. I'm wearing a sweater. And I'm wearing like pants, but I'm wearing leggings under my pants. I'm wearing like business flats or whatever, but I'm wearing socks with them. But today's a lot better than yesterday. Yesterday was cold, and I was just wearing a dress and like my white coat and the jacket, and like in the afternoon towards the evening I was freezing because I went to the grocery store and stuff like that. But nah, this time I'm not playing no games. So I think if I layer very well under this jacket, I won't be cold. So tomorrow is gonna be another practice. Tomorrow is gonna be definitely another practice, but it just depends on what the weather is like tomorrow. But I'm walking to the bus now. I mean, not the bus, the train. I'm taking a different route today. My younger sister said she's gonna meet me at a certain stop so I could take a bus. Because yesterday I was doing a heck of a lot walking. Yesterday I took the 2 train. So I had to walk like 12 minutes to the 2 train. And then when I got off, what's it called? I had to walk like almost another 20 minutes to the clinic. And my sister was like, yeah, of course, Sheila, you were tired. Because I did that both ways. She was like, of course you were tired. You should have I thought you took the bus. I said, nah, homie, I didn't. Because for me, in my head, I was like, why would I take away? That's going to take me 50-something minutes, almost an hour. When another way can take me like 50 minutes or like 45 minutes if I speed walk. But honestly, please let me go ahead and sit my butt on a bus, because hey, it's too cold to be walking. So I need to make sure that every day I leave early, because today I didn't leave at the time I wanted to. So I gotta figure out a better routine. But I need to make sure I leave early, because I know when it gets like to be winter, everybody and their mom is gonna want to be on the bus. So I need to make sure I get myself a little seat, okay? Because I do not want to be standing. All right. Hopefully today I come to debrief you guys when I get home. This is what the clinic rooms look like. I just kind of wiped down everything. Hey guys, so I made it back home. Right now, currently it's 5:30, so let's just start off with an outfit of the day, and then we'll recap about what happened today. So yeah, it's cold outside. It is. It's cold outside. My hair is looking all funky now. I don't know what happened. It was in a bun earlier, and then I don't know. AirPods right here. All right, so this was the fit today. I had this green sweater. It's my mom's, but she gave it to me. And I have these black pants. I'm gonna try and back up so you guys can see. I don't know if you guys can see that. But there are these black pants that go all the way down. Now today it was cold, so I put leggings on under these pants. Another thing that I noticed, like the other med students, they don't wear a white coat. So I don't know if I'm like doing too much wearing my white coat, because like nobody else wears a white coat. Cause like our administrator, like the person, like they're not our director, but like the person who does like sends the emails and stuff, and like knows a lot of information about us. He said like the dress code was business casual, but he never said like with white coat or without, or like no white coat. And then I remember he did mention like just don't wear scrubs. So I may try tomorrow not to wear a white coat, but I'll still put my coat in my bag. I think that's what I may do. Today, let's start off with today, how today went. So today I decided to take a new route to get to over there. Today we started at 8, right? So I decided to take a new route to get there. And yeah, that was an entire mess. Let's just fast forward to say I got to the clinic at like 8:01 or something like that. And I know that they say Monday, Tuesday, Thursdays, and Fridays, we have morning teachings from 8 to 8:30. So I went up to, I put my stuff away in a locker and I went to the preceptor room. Nobody in sight. I went up to the 4th floor thinking that, you know, that's where the teaching is gonna be, because that's where we did orientation. And I asked someone over there, and then she was like, no, like they don't generally start rolling in until around now, like the people. So I was like, so are they just saying morning teaching for no reason? So then I went back downstairs to the 3rd floor, and then there's somebody next to the preceptor room, and he was introduced to us. So he kind of like knows a little bit of things. So I asked him and he was like, they generally come around 8:30. So I just say like, sit there, like just sit and wait. So I was in there waiting. So I was like, okay, bet. Then maybe I am early and I'm not too late. Like maybe, you know, it like they don't start till 8:30 and then we'll be doing the meetings from 8:30 to 9, like the teachings from 8:30 to 9 or something like that. You know, I'm making up excuses because yesterday, I don't know if I did tell you guys I had went to the employee health. So when they were doing the tour of the facility and stuff like that, I only saw a bit of things. I didn't see everything, right? So I didn't see where we're doing the conference, because I know on Wednesday mornings from 8:30 to like 12, from 8:30 to 12 we do morning didactics, right? So it's like teachings, you know. So I know that on our orientation paper it says conference room A and B, and it's on the 2nd floor. Got it, boom. But I don't know if they may have said like where the morning teachings are meant to be. So I was sitting in the office, sitting there, and then a doctor walks in, and I'm like, hey, and then she was like, oh, are you a medical student? And I'm like, yeah. So at this time it's like 8:20, and then she's like, you know, you're supposed to be at the morning teachings. And I was like, I've asked so many people, and like they have said that nobody shows up until like 8:30. So like I didn't know. And she was like, oh, well, it's supposed to be downstairs in the conference room. And I'm like, well, I'm telling her like I didn't know that it was going to be there because I wasn't told that yesterday, you know? Like, you know, so it was kind of like, but, you know, I think because usually like something like that, I would say like in the past, like things like that would freak me out. But at this point, I'm just like, Sheila, it's all right. Like, all right, you made one mistake. You didn't even know. Like, it's fine. So she was like, and it was already 8:20. I wasn't gonna go downstairs because I was like, that joint end at 8:30. It don't make sense. If I go downstairs now, then it looked like I'm late. Like I'm super late. So let me stay upstairs and it'd be the reason that I just didn't know where it was. Or like I didn't know it was happening. So I stayed upstairs, but she ended up pairing me with a certain resident today. That's my dude. That's my dude. I like him. He's a 3rd-year FM resident. He's pretty chill. He's pretty lax. With him, I kind of somewhat learned a lot. He was kind of like, you know, like you kind of like, I guess like from his perspective, you kind of get to see like, not politics, like a bit of the issues that come into clinic life as far as like when there's a patient who was meant to be there at a certain time and then they come like super late and then they get added onto his list, or he's seeing other people's patients when that person, that doctor is there, you know? So like for our thing, what ends up happening is that the residents are the ones that see the patients, and then before they tell the patient like what are the next steps, they go to their preceptor, which is an attending, and they give like a little quick like presentation of the patient and then what they think that they want to do, and then the attending will be like yes or no type of thing. So yeah, so I don't know if I explained that yesterday, but that's how they do it. So I feel like it gives them a bit of autonomy. Today we saw when I came to him, he was already seeing a girl that was in high school, and then after that we saw 2 kids. So with that we were able to do like child visit. So like they were 3 and like 2.5. So we were able to do that before. And then before the kids, we saw another lady. He asked me to do an MSK exam. So I was doing it, but you know, like those situations where you're thinking to yourself, like you're telling me to do an MSK exam, but it's not like he was telling me like in a way that it was making me feel inferior. It was more so like, oh, are you able to do it? Like, I'm here to help you. But you know how like those moments where you have like second guessing yourself? So that was kind of one of the things, because I actually knew what to do. So one thing about it is I need to be a little bit more confident about certain things like that. Another thing, but then I think what it is because I was like, dang, MSK, that used to be like my struggle exam. But like, honestly, it's really just touching the spinous processes, then the paraspinous process. Tell the patient to lean forward and then lean backward and then side and then side and then this and then that, like to see if they have like any pain anywhere. And then obviously like our patient had like a boatload of pain. So he was telling me to do a straight leg test, but because she had, the patient had like limited range of motion the entire time, he was like, nah, don't do that to me. I was like, okay, bet. What else? We saw child visit. We were going over milestones, so I think that was pretty interesting, like as far as like asking the parent like certain things that the child can do, just because you know when a child is like younger, you'll probably have to ask the parent for that kind of information. And then for the first time I heard about this, I forgot the name of it, but it's like an autism screening tool. That was pretty interesting. I'm gonna look into that. CHT something. I don't know, but I'm gonna Google it. And then what else today? Ooh, first off, I mean, like I knew, you know, family medicine is all encompassing. I know family medicine does like OB things as well, but I always, and I knew like it's an ability, like family medicine docs have like an ability to do all of those things. But I guess like for my perception, it's like when I go to my doctor is an FM, right? They don't do pap smears at like that office. right? So like I have to go to like an OB, right? OBGYN. But here he was like the doctor was like, oh, we're gonna do a pap smear, go and call the medical assistant. I'm like, okay, you're gonna do a pap smear, go and call the medical assistant, okay. Goes and gets a medical assistant, she's getting all the tools out, and I'm like, oh. And then he starts like, you know, he starts doing it and stuff like that. And I'm like, oh. And then I'm standing off to the side here because the patient is here and then the doctor is here. And, you know, I don't, like, you know, I'm a student. I'm not trying to be in the way, but he was like, yo, medical student, come here. Can you see the service? And I looked and I said, oh. So, like, that was my first time seeing a live service. I said live service, like a real one day. It's pretty interesting. And then they did, like, you know, swabs of certain things. So, yeah. But, yeah, that was today. He gonna be there Thursday. I gotta remember his name because I like him. And I actually learn a lot because I feel like I ask a lot of questions and then he answers them. I thought we could use this for this. And then he'd be like, no, like we don't use that because of this, that, and the third kind of things. Disulfiram, right? I was wondering why they wouldn't give disulfiram to somebody who is using alcohol, like has alcohol abuse disorder. And he's like, because I was like, oh, like it'll give them adverse reactions, so then they don't want to take alcohol. But then he's like, but the caveat is that they will realize that that causes the adverse reaction. So instead of it being a situation like, oh, let me stop drinking alcohol so that way I won't have this adverse reaction, it will be more so like, let me stop taking this medication and let me continue to drink alcohol. And I was like, oh. Some of these things are very interesting. I definitely do think that today is just day 2. I definitely do think that family medicine is pretty interesting. It's all encompassing because they are seeing a lot of various things. I think I do like it, but I don't want to like be like, oh, this is what I want to do type thing, because I don't know. According to my schedule, I thought I was supposed to do just 6 weeks of the clinic, but I guess in like 3 weeks we're gonna be put into inpatient, which is perfectly fine. Sometimes they may have you do days or nights, but you work every Monday through Friday 12-hour shifts. So yeah, but the one good thing, we won't have weekends. So I'm like, okay, if y'all talking about just work Monday through Friday, let's just do it. Let's just get the coffee. Let's get everything. So today, while I was even there, there were some things that I'm missing. I need a lunchbox. So I ordered a lunchbox off of Amazon. I ordered a coffee mug, like the thermos, like the traveling one. So then that way I could just put it and then like drink it on the bus, right? And then I ordered a water bottle because I need one of those. I ordered a Brita filter just because I'm just at this point, I'm like, I'm treating being here in the city like if I'm in Barbados, like when I was on island, because I'm just like, I will save a lot more money just by using the Brita. So just put it in the tap, let it filter, and then put it in the fridge, because like here it's like stores aren't as close, and water is expensive. Like the city is very expensive, okay? It's very, very expensive. So I'm really trying to budget well, because you know I'm trying to save. And then also it's not everyday school, okay, my dear. I want to go next year. I do want to take like a trip somewhere. Actually, I would like to take 2 trips, but we'll see if that happens. But I do want to take a trip during one of my breaks. I think I have a break in February, but I don't know if I want it to be like an out of the country one or like in the US, but we're gonna see. But I'm tripping a while and I'm fiending. So yeah, that's that, guys. So yay, day 2. So I think I'm just gonna vlog this entire first week, and then from there I I am going to probably give like I'll probably make a video of like a recap of the entire rotation, like after I did my shelf and everything like that. So that'll probably be later on. Keep an eye out for that. We shall see. Okay, bye. Hey guys, good morning. Today's day 3. This is my quick outfit of the day. I'm wearing sneakers today because I can't. What am I wearing under this? I'm wearing a long sleeve shirt and I'm wearing leggings under my pants again. These pants are kind of like to the ankles, so the leggings go past it, so I rolled the leggings up at the end. So yeah, I'm trying to scarf down breakfast really quick. Because I should have left at 7. It's 6:58. And this morning, I think I have a little more time. Because we start at 8:30. So. I definitely know today I'm going to take the train. And then I think I'm going to take the bus. I think that's what I'll do because my mornings are too cold to be walking that 20 minutes that I did on the first day from the train to the clinic. Too much. But it was good exercise. I'll probably be able to do that more in the springtime. Because it won't be cold. So I'll be chilling. My alarm just interrupted. It's 7 a.m. now. I need to leave here by 7:05. And I need to look up the bus routes. I've been seeing this new coffee on TikTok that a lot of people are using. Like, you know, the people who make the iced coffee at home. You guys know what I'm talking about. This. But I got the intense version. I meant to get the blonde because that's what everybody uses. But this joint is good. And I'm not like a coffee connoisseur, but it tastes... Nescafe be making some good coffee. But it's expensive. But I don't know if it's because of where I bought it. Because I get it like... I don't know what I feel like it's kind of bougie. Because there are some good deals. But like, some of these are overpriced. And the feel of the place, I don't really shop at Winn-Dixie, for real. But it feels like a bougie Winn-Dixie. So, yeah. But they had like some good deals on that off-brand stuff. Like, I don't eat Hungry Jack pancakes. But there was a deal on that and the syrup. So, why don't you have? Why don't I go and get Aunt Jemima, which is like my favorite? You know? My favorite deal. Right here. I need to work on time. Last night I was asleep at 10:30. So be honest, I need to be asleep by 10. But last night, I did 15 questions. I was proud of myself. Did I do well on those questions? No. See, but I'm not a city girl. It's too cold. Last night I looked at the weather for this morning, like 40-something degrees. I said, excuse me, what happened to fall? What happened to fall? I think the temperature gets real high either. Like, I think the highest is like low 60s. Like, excuse me? Like, y'all can't allow me to get a little warm up first? Like, you just went straight to cold? Out here having people freezing them like that. My mom gave me these pants. And they're cute. Don't get me wrong, but they're like low rise, so they keep like going down. And that's why she gave it to me, thinking that it would be better on me. Nah, homie. It keep going down on me too, but I'll talk to you guys after. Good morning, you guys. Today is Today's Wednesday. Hey, no, it's not. Today's Thursday. Hallelujah. Just Friday tomorrow, and that's it for the week. But today is Thursday, October 17th. I'm on my way to the train. I'm almost there. Today we have to be there by 8. Haven't eaten breakfast yet. But last night I was supposed to give you guys just when I got home, but I forgot. But yesterday I went to my family's house and I ate dinner there, and I had ordered some stuff off of Amazon, but the stuff off of Amazon didn't come. Well, like, part of the stuff didn't show up. So I'm out here, like, you know, I was able to get my lunchbox, I was able to get a coffee mug, and then my ice pack, but I wasn't able. My Brita didn't come, my water bottle didn't come, and like my straw cleaners didn't come, I think, something like that. But I was kind of annoyed because why y'all sending all that stuff separate? Why didn't you send it together? But anyways, I made it to the train station. Hey guys, good morning. This is my fit check. I'm not wearing a white coat today because it seems like everybody doesn't wear a white coat, so that's what we're gonna do. Hey guys, good evening. It is currently like 5:30, almost 6 or something like that. I don't remember, but I just got home. So yeah, today how was clinic? Clinic was cool. This was the outfit today, just this top with the purple pants and what's the thing called? Sneakers. So yeah, I didn't wear my white coat today. Like, I had it on at first and then I took it off just because, like, ain't nobody wearing it, so I'm not gonna wear it. Today saw a couple cases. We had like morning teaching. I finally went to the morning teaching. We had the morning teaching for postpartum blues versus postpartum depression. So that was pretty interesting, and we had a discussion on MDD yesterday, major depressive disorder. So I felt like that was nice. I took some notes. Today in my downtime, I made sure I was doing some questions from Amboss because our school has not given us the UWorld subscription yet. I know, like, you know, someone else may say, okay, well, I'm in my first week, I don't really need to be doing all of that. But I kind of just want to get into the routine of somewhat kind of doing it. So then that way it's not like when I need to go full force studying, I'm struggling to. So I'm taking my time. Today, I believe I was able to do about 20 questions while I was at clinic. So that was pretty good. So yeah, but yesterday I only did 5. You know, you win some, you lose some. Did 20 questions, so I'm about to like chill, eat. I bought a chopped cheese and a malt. I just realized that there's a deli or corner store / deli that's like not too far from where I stay. So like maybe like a 2-minute walk. So I'm real happy about that. And they also have chicken over rice. They call it like halal food, but you know, we know, I mean, you know what I'm talking about. But yeah, I kind of saw how they have like this depression screening. It's called, like, they have PQ2 and then PQ9. So the resident that I was with, he used that screening on a patient. So it was pretty interesting to hear and see. And then we had a patient who actually had like a kind of like a systolic murmur. So like a systolic murmur, but I'm not sure what it was. Like, the resident told me to listen to the heart, and I was listening. I didn't hear nothing. Sorry. I didn't hear anything at first. And then he went to the mitral area and he was like, it's right there. So I was like, okay, bet. And I was listening to it. And then I feel like I heard it. But I definitely do feel like maybe I should watch a couple YouTube videos, like just listening to heart sounds again. So then that way I kind of know, you know. But tomorrow's Friday. I definitely feel like this week went by very quick. Even though I was hoping that today was going to be Friday, but like overall this week went by very quick. So I do understand what people mean when they say like 30 years goes by quick, because I have this feeling that I'm going to blink my eyes and I'll be at the end of third year. So I'm just hoping to absorb as much information as I can, try to do my due diligence to try and study as much as I can, do as much as I can to put my best foot forward. And, you know, always in anything, I keep prayer as my number one, because I know like I would not have gotten to this point in my life without God. So yeah. So I'm about to eat. I'm gonna shower and I'm gonna relax, because this waking up, like we gotta be at clinic at 8. And this little waking up I'm doing at like 5:30. Yeah. Hey guys, good morning. So this is my fit today. This is my sweater. Actually, a lot of the sweaters that I've been wearing these past couple days have been from Fashion Nova, because they were having like a sale at one point, sometime this year. Can't remember, but a lot of the sweaters were like $3 or $5. And this is actually like pretty warm, but I feel like this one is a little bit on the thinner side. So I have a long sleeve shirt underneath. I'm wearing these pants. I've had them for years. The sweater in because it looked weird out. I think it's with these pants. I'm gonna wear a pair of sneakers. It says that today the weather's gonna go up to 60 something. So I'm not wearing my big jacket. I'm just gonna wear a hoodie. I'm just kind of annoyed because I have a heck of jackets at home and I put them to be packed and I didn't pack any of them. So I only have 2 jackets here. The hoodie that I came with the day that I arrived, and then the big jacket. I'm so annoyed with myself, but it's okay. When I go home, I'm gonna get all of that, all my jackets. But I got my mug of coffee. This is it. I'm over here looking like a ball. But I had to cover my head. Another bus of mine that I don't do. I need bus 2111 has come to time. Why? Are they? And they be packed like sardines inside the bus, inside the train. And I know I used to come to New York when I was a kid, so like I'm used to it, but it's just too much. And then the bus is packed, but then the bus driver will still stop to let more people on. Menciasi. Hi guys, so today is Saturday. I meant to talk to you guys back yesterday and I didn't, to give you guys like a whole synopsis of the entire week and how I felt. So I'll probably do that when I get home. Right now I'm going to the Chinese buffet with my family. I believe it's like the Chinese buffet like near Co-op City. We used to go there with my dad when he was alive. So yeah, I haven't been there in years. We were on another train. We were on the 6th train, and then all of a sudden, and it was one express, and then all of a sudden they said it was the last stop, and everybody was confused because it was like, y'all didn't tell us that this was the last stop, so now we have to wait for another train. But when I get home, I will give you guys just like a little thing of this week, of how I feel about family medicine, and I'll let you guys know. We're going into week 2 starting tomorrow. Today's Sunday, so yeah, but it's going by fast and the sun is sunning. Good morning, you guys. I know, long time no talk. I keep saying, oh, I'm going to like go over last week with y'all, but like I've been tired. Today is Tuesday, October 22nd, and I am currently on my way to the train station to go to clinicals today. Today the weather is about like 50 something right now, so it's not too bad. I just have a cardigan on and this like semi turtleneck. So yeah, how was last week? Last week was okay. I feel like, I definitely do feel like from last week, it seems like family medicine is a little bit repetitive. Like sometimes you do get a bit of cool cases. Like I've seen like a Hep B, yeah, I've seen a Hep B. I've seen like, you know, like 2 pap smears, and things of that nature. Obviously we see like the STI, STD type of stuff, but that's not like too often. But we see a lot of chronic pain. So that's that for that. So yeah, but I mean, I think it's okay. Right now, I've been trying to figure out how I can like start studying for real. Especially because after I'm like exhausted and my commute is like, almost an hour, like I told y'all. And then like, you know, when I leave clinic, it's even worse. It's like an hour and a half, almost 2 hours, depending if buses are delayed, because to come back I take buses. So it just depends if buses are delayed and things of that nature. So I don't know, but what I've put in my planner is to kind of do about 30 questions a day, and then on Wednesdays, which are the days that I get off later, which is like around 5, I say to do like half those questions, so 15, or I do 10. So right now I'm doing UWorld. Last night I did 30 questions. We all know how UWorld can just be humbling you. And what I've realized is a lot of these questions are just more so like management questions, or like, you know what it is, and it's like, okay, what am I gonna give? So it's making you put on your clinician cap, which I feel like it's a good thing, because it's one thing to know the information, but another thing to like try to be able to apply this, the information. But I definitely do think that it's like a lot of relearning, in the sense of like how I'm supposed to be answering this question. And like there's been a couple things that I've come to, like even when I was doing AMBOSS questions, because I had been doing AMBOSS questions, you know, throughout the week, last week, to try to get my mind in the groove of studying again. There's like a couple things where it's like, I've been thinking and I'm like, I know what this is, but I can't remember what it is. Or it's like something that I should know, and then I don't remember what it is. So I think it is a lot of, medicine is a lot of learning and forgetting and relearning. That's what I've learned. But other than that, it's been good so far. What I've realized is it's really very much about like time management and making time for things, so that when I get home I can like chill. In a clinical year, of course, do I want to do very well on this shelf exam? Yes, but I cannot come and kill myself. So my first 30 questions, I got a 43%. And even just by looking at the ones that I got wrong, I realized that some of the questions, it's like I knew the answer, but I chose something else. Or it's just one of those things where it was like, oh, I thought that I knew the answer, but actually you did not in fact know the answer. There was one question on osteoarthritis of the hand, and I was like, okay, well, I know osteoarthritis, they kind of give the same medications as if somebody has RA, because I knew the person had osteoarthritis because of the way that the hands were looking. But then the explanation was telling me, so I put like a glucocorticoid, but then it was like, no, like for for osteoarthritis, you gave like a topical NSAID or an oral NSAID. And I was like, wait, that's so true, because even with RA, you can give an NSAID if the person is not having like too much problems. But then when it starts to get like worse and worse and worse, you give glucocorticoid or you give methotrexate. Those are like the first line cup of stuff, and then like the stronger for like chronic or other things. But like those are for acute cases. So I was like, okay, well then that makes sense. My bad. I pray not to get it wrong again. Is that a 2 train? Whoops. So yeah, that was FM first week. And also just to let you know, a couple thoughts on my way to the train station. So yeah, I'll show you guys my full outfit later, probably without my white coat, so you guys can see, because like I love my top because of the sleeves of this turtleneck. Like they have like pearls on them. It's so cute. Alright guys, I'm out for today. It is like 3:57 or so today. Honestly, I didn't do much. Yeah, I'm not even gonna front, because the first resident I was with had like a lot of administrative work to do, so I feel like that was kind of like a good segue for me to understand like the administrative roles that has to be played, and then like insurance and things of that nature. So like I got to know a little bit more information about that. I didn't have any patients with him. He said he only had one patient that day, today, so I couldn't get on that. But today, the exciting thing is, irregardless of that, or irrespective of that, I assigned myself to do 30 UWorld questions today for FM. I completed all of them. I reviewed all of them. I even reviewed the question from yesterday that I was not able to finish reviewing last night. So today, when I get home, I'm just gonna pull out the Anki for the ones that were the incorrects using the UWorld filter code, do the Anki, and chill. So, yeah. You know, when people stay because you have to come out and goodness. But yeah, that is so proactive doing it, because we don't know how tomorrow's gonna be. So, you know, every day has its ups and downs. And although I didn't really see patients today, I learned other things, and it was an up because I was able to complete all my questions today. So that was lit.